Welcome to Downstate and to University Hospital Brooklyn. I am delighted that today your SUNY Downstate Medical Center is the first academic health center and hospital, the first in New York City, and the first in the entire SUNY system to use the BioVigil hand hygiene system. We are absolutely thrilled. This is our attempt to improve the patient quality, our patient experience by decreasing hospital-acquired infections with this state-of-the-art novel technology that really encourages us to practice good hygiene habits in terms of hand washing. We are going to roll out to 1,875 healthcare staff, clinicians, physicians, nurses, PAs, nursing assistants, etc., who provide direct care to our patients at Downstate to more than 72,000 patients each year. They will now be protected with the use of this wonderful technology that ensures that hand washing and the use of alcohol-based sanitizers becomes a more routine part of the clinical care program here. Our hospital staff will wear badges, just like I and my colleagues are wearing. When used properly, will sense when they have already washed their hands or used an alcohol-based sanitizer. Like traffic lights, as we drive along the street, it'll be color-coded, red, yellow, and green. Green means that your hands are clean. Yellow is a reminder to wash your hands upon entering a patient's room. And red means non-compliance and wash your hands immediately. So it's the three colors, green, yellow, red, that all signify what you should do or if you're in compliance with good hand hygiene before that individual patient encounter. Now again, these infrared sensors, or these badges, will communicate to infrared sensors that will be placed in all patient care areas. And the BioVigil badge is designed to monitor and detect each user's hand hygiene activity. In addition to just notifying the individual caregiver about the state of your hands, we'll also be able to collect statistics. And these statistics are very important in academic health science centers because we like to do things that are data-driven. We like to use data to improve our patient care. So the statistics that we'll derive from the encounters with the BioVigil hand hygiene system will go a long way in terms of providing good quality academic work that supports and improves patient care here at Downstate. Now, we've been anxiously awaiting the official rollout for quite some months now. For the past 8 months, we've had sort of a testing period, and we've had more than 1.2 million hygiene observations recorded and analyzed by this hand hygiene system. So again, we think this is state-of-the-art equipment and an initiative that will really dramatically improve patient care and safety in the University Hospital Brooklyn and here at Downstate Medical Center. And again, we are delighted to be the first hospital in the New York City, the first in the SUNY system to embrace this wonderful technology to decrease hospital-acquired infections. So again, on behalf of all of us, we're just absolutely thrilled that this new technology is here helping us to take care of patients better. So I'd like to now introduce Sarah Haroff, who's the Director of Client Services for Ann Arbor, Michigan-based BioVigil. And we've also worked with her colleague Amy Malloy Williamson, who is the Regional Sales Director for BioVigil, and I'll ask them to come up in the order to share a few words.
Dr. Riley said, my name is Sarah Haroff. I'm the Director of Client Services here at BioVigil. And I just want to reiterate what he said. We are very pleased to be here at SUNY, going house-wide. It's very exciting for us. This is, I believe, one of our largest hospitals that we're launching in. When you cited the, what was it, 1,900 people that we're training. So that means I think I've trained about 1,000 now, so I'm a little over halfway. I've been very impressed with the staff at SUNY. Everybody's been really supportive of this rollout. We were working with the pilot, with the infection prevention team, and they really helped us get this thing off the ground here. And then since then, we've been working with the larger organization, the operations office, and it's been a great journey so far. So 1.2 million hygiene observations in just 3 units over 8 months. You can only imagine what we're going to see once we're house-wide in over 350 beds at this hospital protecting your patients. As Dr. Riley said, this is all about patient safety and improving the presence of care here at SUNY so the patients can feel very comfortable and confident seeing that green hand. That's awareness for those patients and their family members to know that they are getting the highest quality of care. The individuals coming in contact with them, from environmental services all the way up to the physicians, have clean hands and they can feel safe. We have, in the hospitals that we've been working with so far, we're working on publications demonstrating very high reductions in infections, statistically significant reductions in infections with CLABSIs, CAUTIs, all those things, hospital-acquired infections, from rates from a 30% reduction as high as 80% reduction. And we're eager to have those published in academic journals and work with SUNY on additional publications and studies. We're also finding that there has been a reduction in staff sick time among hospitals that have been using the system. So not only is there benefit for the patients, there's benefits for the employees and the hospital staff as well. And we want to be looking into that while we're here at SUNY. And the third thing that we find with the system is that patients who are in hospitals using this system have an increased satisfaction scores with the hospital. So there's an additional benefit for the hospital there, that those patients that are being served here have that demonstrated feeling like they're being really cared for, and a real positive feeling of coming out of the hospital. So there's a lot of benefits to the system. We're excited to be here. We're here to support you. I'm from Ann Arbor, Michigan, but I think I'm going to be spending a lot of time in Brooklyn, and I'm looking forward to it. All right, thank you very much.
Thank you. Amy, quickly.
Yeah, sure. Good morning, everyone. Amy Williamson. Just wanted to say that I'm so impressed with how everyone is handling this launch and the training. I was here a couple of weeks ago with our CEO, and we could feel the excitement for this particular product, and we are so excited to partner with you on a life-saving product that is absolutely groundbreaking. So I appreciate it, and thank you very much.
Thank you very much. BioVigil colleagues, we're delighted to have you with us on our patient care journey. Next, I want to introduce the Managing Director of the University Hospital Brooklyn, Mr. Bill Walsh, to also provide a few words from the administrative team. Mr. Walsh.
Thank you, Dr. Riley. Good morning. It's a pleasure to be here today. This is a very, very important initiative. It's about patient safety. It's about taking the best care of our patients. It's a way to use technology to remind our caregivers to wash their hands, to practice appropriate hand hygiene, and it's a way for us to engage our patients and their families in their care. So once again, I'm delighted that we're launching this new technology, and we have very high hopes for its success.
Thank you. Thank you, Mr. Walsh. Now I'd like to introduce Dr. Mahfouzar Rahman, who is Vice Chairman of the Department of Medicine. But more importantly for today, he has been the champion among champions to get this technology to University Hospital Brooklyn and to our great medical center. So, Dr. Rahman, I want to thank you for your leadership and ask you to say a few words in your role as Vice Chairman of Medicine, but also as our Chief Medical Information Officer as well. A very important role where his responsibilities involve clinical care, but using technology to improve clinical care. So, Dr. Rahman.
Thank you.
Yeah.
Good morning, everyone. Thank you, Dr. Riley, for the introduction. I am very excited and honored to be actually part of this hand hygiene endeavor at Downstate. As a part of the medicine team, we have about 200 residents and fellows, care for about 50 to 60% of all the inpatients. Basically, what I'm trying to say, we have footprint everywhere, in every area, training, clinics, inpatient, everywhere else. You all know very well from what Dr. Riley stated earlier that proper hand hygiene actually reduces transmission of infections, decreases the length of stay, decreases patient morbidity and mortality. We looked at various methods on improving hand hygiene parameters, numbers. What we have found is that BioVigil has been one of the leaders in that field. So with tremendous help from administrations, from every person in this institution, we were able to launch today this important clinical endeavor as well as a technological future. What I'm requesting from every member of our team, our community here, is to be the advocate for this. It's going to be as good as how we treat it, how we advocate for it, how we let our trainees, our staff members know that we have to comply with it. And I'm hoping by meaning to comply with it, we are going to reduce infections, spread of infections, and help and improve our patients' lives. And I'm looking forward to it. I'm very excited, and I thank you very much for coming together to launch this project for the future of Downstate to be the first hospital in New York City and first hospital in the SUNY system. Thank you very much.
Thank you. Anybody from our clinical care team want to say a few words before I think we're going to go up to the 8th floor? Well, thank you very much for coming, and thanks to all of our clinical and nursing staff for their leadership getting it to today. And again, we're doing all this for our patients and for improving the quality of care we give at the University Hospital of Brooklyn. Thank you.
Okay. So this is our electronic area. You cross through here. The computer is going to say you cross the patient care area. So you will need to change into orange. Then you will need to do the hand hygiene. Hand hygiene. Basically, what I normally do is get a little alcohol, rub it in my hands nicely, and not dry. It's supposed to be 75%.
It's got to be a little
wet in there, and then just cup it in there. Cup it there with my hand.
So you just cup
it in there, and you'll sense the alcohol, just like that. You sense the alcohol.
And then you hear the beep.
And you hear the beep in your phone. So it has the both audio visual. It will change color as well as it will beep.
Oh, I didn't know it had the beep.
It prompts you to alert you that it's also a reminder that it prompts you to let you know that it's time to clean your hand. The green say it's okay, you're compliant with it. The yellows mean is letting me know that look, you have to wash your hands, and if you let it turn red, that's mean you left the room without washing your hands.
And that gets recorded as a non-compliant encounter.
Got it.
So the hand hygiene is considered for that reason.
Good.
Yeah.
And these
So
are the
that's the
sensors
RFID
here. Right.
sensors, exactly.
Right.
So if, however, in an emergency, I needed to go in and I'm not touching the patients, I can go in and come back within a minute. It will not do anything else. And it still has to cross a 1 minute barrier. The other thing is, in case of emergencies, like we're running a code, we're not so. With the luxury of the time.
Yeah, right.
At the time, we can
so
actually turn it off. I can press that button, hold it, and it will actually go off. However, that will be recorded that I turned it off.
Right.
So if somebody tries to defeat the system by going through it all the time, they'll turn it off. Every time they go in,
can't be going to that many
Exactly.
codes up.
This is another prime example. My badge just turned blue. It's letting me know I'm in front and I'm close to the sink, because on top of the sink it has a sensor also to let you know that
right
you're
there,
close,
yeah.
you could wash your hands.
there are incidences where that is inappropriate. Like for example, Clostridium difficile, blood products, or anything where you need to wash your hands, you actually have to do it at the sink, and that's required. So when you do it for 15 seconds, you have to do it for 15 seconds. When you do that, you put your hand with the moisture in there, it will recognize it. But if you don't spend the 15 seconds, it will say that you did not comply with the hygiene as required.
And also adding on to Dr. Ron and Sarah, I'll piggyback on that. When you have a patient on contact isolations, we also have a special bag that has a sensors in it, prompt you for the isolation patients only. And then when you activate it, it only allowed, you cannot use the alcohol base, you have to use the bleach. And then you must wash your hands in and out. It will not allow you to use the hand base, the alcohol.
So the alcohol base wouldn't.
It would not work if it would not be effective.
It would not be appropriate, so we're training our staff. So that's why I think it's so important that all our staffs are being educated by the BioVigil folks, and that we all have to be sort of like individual super user, educator, compliance officer, whatever you want to say, for all the time in all areas. And that's why I'm so appreciative of our staff members here.
And it's also is 100. We've been 100% compliance. We were one of the first unit downstairs that we did the pilot on. In the beginning, it was a little bit challenged, but afterwards, it started the staff getting abide by it. Even the patients are asking nurse, "What is this badge in front of you? Why is it changed color?" So we had to explain to them, and the family. this is the color, when you see the nurse come in, this is the color that she has to be. If you see a change, it's also patient and family engagement also.
Right. Are we going to give the patients a little one-pager so that the patients can see it when they get to the room? Margaret,
Yes.
just see a one-page, very simple.
For the orientation.
Right. During when the nurses orient the patient once they get to the room and the family. Yeah. Okay.
We are actually encouraging our patients to ask the doctor.
Right, and to ask, right, yeah, and you can put that on the one pager.
Right,
Please ask
right.
your doctor or your nurse about,
Yes.
yeah.
And one of the other benefits that Robert is not here, that always talks about, we wear the BioVigil up here, not like on the
Below your
belt,
waist,
not
right.
below the waist, because
Because
we're
that's
not
to be visible.
visible. When
Right.
you talk to the patient looks at the doctor's face or the provider's faces, and they see it right there, it's red. And like you said, green is good, red is bad. So this kind of, this is why I guess BioVigil decided these are the numbers, the colors that they're like.
No, it's
Yes.
good. It's very, very easy to figure out. Okay, good. It's a little bit of a reminder system that's visual and audio that, again, helps you to wash your hands more effectively.
Got it. And tell us a little bit more about why this has been implemented.
This is being implemented because all American hospitals have problems with what we call hospital-acquired infections. That is the infections we bring to the patients or the patients bring to us, and we spread through our contact with patients when we're examining patients, when we're serving them, when they're drawing their blood or performing a procedure. So this system will allow us to really have a better sense of how clean our hands are. And as a result, we know the data suggests in the pilots and all the other testing that we've undertaken over the last 8 months is that it will decrease the amount of infections that occur in our hospital, which again is good for patient quality, it's good for patient care, and it saves lives. We are the first hospital in New York City and the first in the State University of New York system to implement this BioVigil hand hygiene system. We're very proud of the fact that we are the first hospital in New York City to bring this technology to patient bedsides. We think that this technology is so good that there'll be other hospitals in New York and around the country that will adopt this very nice technology. We want to have improve our care, improve our quality, and most importantly, decrease the amount of hospital-acquired infections that occur within our hospital. We know particularly during flu season, one of the best things that you can do to prevent the spread of flu is frequent hand washing. Same thing applies in a hospital setting because hospitals tend to have patients with many different conditions and disorders. They come into the hospital with infections, they pick up infections in the hospital, and so anything you can do to decrease the chance that a patient gets a hospital-acquired infection will pay dividends in terms of less infections.
Well, rollout-wise, as a chairperson for the value analysis team, like I said, we had evaluated our options for addressing the hand hygiene issues, the spread of infections, patient care issues. The amount of results we found were phenomenal, and then subsequently we applied for permission to use the device in the entire hospital with many more staff members. So every user is assigned a key. It's a unique key for a user. Using that device, everyone is required to get a badge. The badge is this one that has the green thumb hand on it. We will be pairing up this device with this badge so the badge knows that this badge belongs to me. During my patient care encounters, I'll be, if I'm going from one area to another, one patient bed to another bed for that matter, as I cross the invisible barrier that we have designated with our RFIDs, it will prompt me first that, you know what, you enter a patient care area, you have to do hand hygiene. So usually, most often, what we use is alcohol-based sanitizers. Once I properly use the hand hygiene protocols, it will turn green. I can stay with the patient for as long as I need. When I leave the room, the barrier recognizes that I've left the patient care area. Again, I need to perform hand hygiene.
Here at Downstate, we're using the new technology in order to make sure our patient care is at top grade and make sure that infectious control is at the lowest possible standard that we could keep it. As housekeeping, we're very busy all the time, so sometimes you might run into a room and running into the next room to take care of a spill, and you might forget, so this alerts you that beep beep, wash your hands, take care, and go along as your day. Like I said, it keeps you on your toes, and It's all for the patients, and here at Downstate, we're all about patient care.
We want to prevent infections in the hospital. We want to provide the best possible care for our patients. Human nature is what it is, and this is really it's just a way to remind our staff when they need to wash their hands and practice appropriate hand hygiene. And it's also a way for us to engage our patients and their family members in their care. We're going to teach them how this works, and when they see a red light on this, they'll know that they should suggest to their caregiver that he or she wash their hands. When a patient is admitted to the hospital, they're oriented to the unit, and this will be part of the orientation. We'll explain to them how the system works and what role they can play in helping us to make sure our staff is practicing appropriate hand hygiene.